My name is Dr. Enfunbo Dosekun, and I'm based in Nigeria. I'm the CEO of a medical service delivery company called Outreach Medical Services. It's been in existence for 6 years. It's quite a new company, but what we are concentrating on is acute care delivery for babies, children, and mothers. As a side product, we also deliver capacity building workshops for healthcare workers in Nigeria. I heard about the program from one of the GE employees in Lagos who had heard about the innovative work we were doing, because what stands us very different from other acute care providers in the private health sector is that we tend to concentrate on low and middle income earners in Lagos, and we are sited in densely populated peri-urban areas. The way I understand this training is that there has been a lot of concerns by the developed countries about the very slow progress that we've been making in terms of our social impact. And I feel they wanted to direct our minds, the entrepreneurs, into knowing that it is not only important to have a passion and to want to create change. You have to know how to create the business model that will make this impact investment sustainable. And that is what I think we have all learned over the last 6 months with our very attentive and patient mentors. I think it is very important because I think change is doable. It's just how to do it. So we cannot reach the stage where we are making impact until we are trained. Over this last 6 months, the way we were nurtured and supported by our mentors, the proposed business model now, over 6 years, we should be able to save 300,000 sick babies. But what we were doing before that, the result that came out from that was 1,300 babies were saved. You can see that it's a quantum leap in terms of anticipated outcomes. And all it needed was just changing the way we were planning to deliver our model of care. The 3-day on-site program, it looked very rudimentary in terms of the content, but that was the beginning. That was the foundation. And from then, it was gradually more, the instructions were gradually more complex and more detailed, but it was built on a fundamental foundation where you needed to know your vision and your mission, you needed to know your target market, and you must be very clear on your metrics and how you were going to measure your metrics. So I think there were very fundamental principles that were ingrained in us, and those allowed us to now, to be able to understand the more complex principles. So it was worth it. And it was also a wonderful session for networking, because we met like people who were all passionate about change in Africa, both Africans and non-Africans. And that was very encouraging, that you are not alone there, and that there were other people, who also had these very lofty, altruistic ideas, who were also grappling on how to make it sustainable. We learned the fundamentals of any business. We learned about strategy, planning strategy, and we learned business management, which was really eye-opening. Currently now, if I'm giving any audited accounts for my company, when before I needed a third party to explain it to me, I can flick through the pages and actually make meaning of it in terms of the financial health of my company. So that was something great that happened. And then operation management, they took us through that. And in the end, we were able to develop a model, a business model that we think many impact investors will be very happy to join with us in this journey. We had 2 mentors and they were incredible. They were very patient and they were not judgmental and they were not prescriptive. So they allowed us with greater in-depth into the running of our business and the community pain we were trying to solve. They let us find the answers. And I think that's really the maturity of our mentors. This newfound knowledge has shown me that in terms of the vehicles or the distribution channels that can achieve the lofty goal of creating acute care for babies, it doesn't have to be outreach only. Outreach can be the guide, just like the mentors were our guides, and we will support and facilitate small private sector practices to support this or to help in the problem of giving early care to sick newborn babies in Lagos. Before the program, I would have thought to create impact means expanding the outreach hospitals. After the program, I now have the confidence now to create a network of private hospitals that were underutilized to train their own health team to now do similar work that outreach was doing. So at a reduced cost for infrastructural development, we are able to create a significant impact, and we should make change in Lagos. And what is so beautiful about this project is that Lagos is like the premier, the trailblazer in Nigeria. So once our initiative is successful in Lagos, it will be successful in Nigeria. Once it is successful in Nigeria, it is successful in Africa. So I really am going to work very hard to make sure that this initiative succeeds and we are able to deliver the metrics that we promised. I think the most incredible aspect of the training was the financial management, understanding the financial health of your business. Because I think when you're a technocrat from another field that doesn't deal with finance and business, sometimes it can be difficult. So I think that's, I would always appreciate that modular training I got on financial management. I would try and encourage other medical entrepreneurs in Nigeria to apply for the Healthymagination program so that they can make the strides in capacity that I have made.